Welcome to week 5, Advanced Pharmacology Memory Anchors. As you know, this is not a full lecture. So pain, don't ask how bad the pain is, ask what type it is. If it's inflammatory, think NSAIDs. If it's neuropathic, think duloxetine. If it's mechanical or topical, think NSAIDs. Osteoarthritis pain follows a treatment ladder. We start with topical NSAIDs, then move to oral NSAIDs, and I know there's a typo there. I'm very sorry about that. If pain persists, medications like duloxetine or tramadol can be added, but the key idea is that it moves from topical to systemic therapies. Neuropathic pain is nerve pain, so anti-inflammatories usually don't work. Instead, we treat the nerve itself. Common options include duloxetine or nerve stabilizers, such as gabapentin or pregabalin. If they have burning or radiating pain, think neuropathic pain and duloxetine. Rheumatoid arthritis is a progressive autoimmune disease, so we treat the disease, not just the pain. First-line therapy is a DMARD, usually methotrexate. Early treatment helps prevent long-term joint damage. Methotrexate is a first-line drug for rheumatoid arthritis, but it does carry an important safety risk, bone marrow suppression. Because of that, patients need regular lab monitoring, especially CBC and platelets. And if a patient on methotrexate reports fatigue, think about possible cytopenia. So the anchor to remember here is with methotrexate, you always want to check a CBC routinely. TNF inhibitors are powerful biologic drugs used for rheumatoid arthritis, but before starting any biologic therapy, you must check for latent tuberculosis because these medications can reactivate TB. So the safety anchor is simple: before biologics, screen for TB. Corticosteroids suppress the immune system. Because of that, patients are more vulnerable to infection. You want to tell your patients to report any infections early. Methotrexate is contraindicated in pregnancy, and NSAIDs should be stopped late in the pregnancy because they can close the ductus arteriosus. So at 30 weeks, you want to stop any NSAIDs. Osteoporosis medications fall into two main categories. Most drugs work by slowing bone breakdown. These are the anti-resorptives. A smaller group actually builds new bone called anabolic agents. Denosumab works by blocking rankle. Without rankle, osteoclasts cannot form, so breakdown slows down. Bisphosphonates have very specific instructions. They must be taken on an empty stomach with a full glass of water, and the patient must stay upright for 30 minutes after taking it. Bisphosphonates are effective, but also long-term use can stress the bone. So after several years of therapy, some patients take a drug holiday. Gout treatment has two phases. First, treat the acute flare with NSAIDs, colchicine, or steroids, and only after the flare is controlled do we start urate-lowering therapy like allopurinol. So you want to treat the flare first. Starting urate-lowering therapy can actually trigger gout flares at first. That's because the uric acid crystals begin to mobilize, so we need to protect the patient by giving colchicine prophylaxis. Methadone has an important safety concern. It can prolong the QT interval, which increases the risk of dangerous arrhythmias. You always want to do an EKG when you're doing methadone, watching for a QT risk. Buprenorphine is a partial opioid agonist. Because of that, its effect reaches a ceiling, which limits respiratory depression. Pain treatment isn't about eliminating pain completely. The real goal is to improve the patient's function. Things like sleep, mobility, and daily activity. You're not going to be able to get them at zero pain, and that's not a realistic goal to have them trying to reach. Okay, let's run one quick control room check. If they're having burning pain, think duloxetine, it's nerve pain. Rheumatoid arthritis, it's autoimmune disease. Methotrexate. Biologics, always check for TB. Methotrexate, always do a follow-up CBC with every routine visit. Methadone, watch for a QT risk. You should be doing EKGs with each of their visits.